Hello everyone, my name is Brianna Reisinger, and today in this presentation we are going to talk about the function of pulmonary surfactant and the ideals behind RDS, which is respiratory distress syndrome. We're going to talk about how these things are correlated and the effects that it has on specifically newborn babies. To begin today, I'm first going to talk about respiratory distress syndrome and what this causes in infants and what leads to the problem behind the ideals of surfactant in the lungs and the respiratory system. When we look at RDS, it is definitely most common in newborn babies, especially babies born preterm. And this can be any baby born before the 39-week period. It's more common in babies around the 28-week mark if they're born prematurely. We see RDS being a problem because this syndrome is directly related to surfactant. When there is not enough surfactant in babies' lungs when they're born, especially when we see this in newborn babies that are born at preterm, they don't have enough surfactant in their lungs, and this can cause some problems, and this is what ends up leading to RDS once they're born. And so what we see happening is there's less surfactant that's being built because this begins to happen at about 20 weeks. They begin to build surfactant, but if they don't have enough, this causes problems when they're born prematurely. So what happens is their alveoli collapse, and this is followed by a reduction of the total surface area needed for this gaseous exchanges that we talked about, oxygen going in and out, and the difference between layers of the lungs and the thoracic cavity and the importance behind that. So basically it causes the child's lungs to collapse when they don't have enough surfactant, and this is what leads to RDS. And so we usually see this happening at about 24 hours after birth, and if it's not treated almost immediately, it leads to loss of brain function, loss of organ function, because there's no oxygen getting to those important parts of their body. And so this can be fatal, especially for babies born preterm. And it doesn't always happen for just babies preterm. This also happens in everyday life when there's injuries. This can happen with normal babies. It's not as common, but this is basically what happens with RDS and the respiratory syndrome. And so it's important that we're able to help treat this because we would see a lot of fatalities. And basically, it causes the baby's lungs to just completely collapse. And like we talked about, this leads to death. Along with RDS, we also can see some downstream or long road problems and other diseases and symptoms that can take place. One of the most common is called bronchopulmonary dysplasia, or BPD. And this is also extremely common in premature babies, and this is a form of a chronic lung disease, and it obviously affects these premature babies because they're lacking the oxygen that is needed in order for them to breathe. In BPD, the lungs and the airways are damaged, and this causes the tissue to destruct, which is called dysplasia. And the dysplasia occurs in what we know as the alveoli, and obviously this is a problem. It can lead to even more complications. It can cause developmental problems, it can cause poor growth, it can cause high blood pressures in the arteries in your lungs, and obviously long-term lung and breathing problems and scarring of this important tissue. In a lot of severe cases for poor babies, we can even see lung transplants being needed. And when we can't find that, then we obviously see more fatalities. And so being able to treat RDS is extremely important. And I'm going to specifically talk about the role of surfactant and its importance to helping protect newborn babies from RDS in the next slide. Now that we know what RDS is, we are going to build off that and specifically get into the role of surfactant and its importance specifically to newborn babies. So like I basically talked about, RDS occurs because babies' lungs have not developed fully enough and they're not able to produce enough substance of surfactant. And like we talked about, this is needed for normal breathing. When you breathe fresh air in and it travels through your airways in your lungs, it travels to those tiny sacs called the alveoli, and oxygen passes from these air sacs into the bloodstream. So basically, surfactant helps keep the alveoli open after breathing. That way we can breathe the fresh air back in easily. So if the lungs contain no surfactant or not enough surfactant, the air sacs collapse after each breath, and this is what causes the RDS. So being able to help this, surfactant's role is essential to correct breathing. Surfactant is made up of a mixture of lipids, proteins, and carbohydrates, and it's like this thick substance that helps reduce the surface tension between the gaseous exchange. Its job specifically is to interface the alveoli during breathing. And so when we look at the mixture of these surfactant, we want to make sure that we're looking at the fact that these lipids, proteins, and carbohydrates are made up of special compounds, and we see this lining being important to the ideal of this protection. And I'm going to continue on this in just one second. This complex mixture of lipids, proteins, and carbohydrates are actually secreted by type 2 alveolar epithelial cells. These secretions is allowing this mixture to be created of both hydrophobic and hydrophilic groups. This means we see things being able to get in and out, things that we want in can stay in, and things that we don't want in don't get in. The importance behind this is we actually see this playing a role in injuries related to our lungs, as well as our immune system protecting our lungs. And so this mixture not only is helping the surface tension, and it's helping decrease that, it's also helping protect our lungs from injuries. It's helping us protect from bacteria and things that can get into our bodies. And so it's really important to be able to look at this mixture and the importance behind surfactant and how it's helping reduce RDS in newborn babies. And so without it, we would see the problems between breathing, and this actually can lead to later on diseases and breathing problems from children if it's not taken care of soon enough. Now that we know what surfactant is made of, its importance, and what it does, it's also important to RDS, as we talked about earlier, but even more so for long-term problems. When we look at the ability of having low surfactant and our bodies not being able to build it when we're born prematurely, it's important to know that if we cannot treat RDS quickly enough, that there are some long-term effects for people. And we see, asthma, we see many breathing problems, but this can affect vision, it can affect bodily movement, basically any essential functions to your major organs, because when you take away the ability for gaseous exchange and for oxygen and for breathing, a lot of bad problems can happen at a young age. And so if RDS is not treated quickly and we're not able to continue this, we see a problem. And in the next slide, I'm going to talk about a couple of the treatments that we do have and the importance behind them in saving babies' lives. Now that we know what surfactant's role in RDS is and the importance behind it, we see the ideals for treatments for RDS. When we look at the ideals of treatments, it's important to be able to save babies' lives. And without these treatments and the ongoing experiments to help treat this and help this problem, we are not going to see any improvement in the world. So to begin talking about this today, we are going to talk about surfactant replacement therapy. And basically the ideals behind this is that we're trying to be able to generate artificial surfactants from animals, from additives, all these important pieces to be able to try to help babies and build their surfactant in their bodies and be able to replace the surfactant that's not there when they're born. And so we are consistently and incessantly trying to figure out how we can do this safely, how we can figure this out, what we can do to make this safe. So all the testing behind this is looking pretty great as of now. And obviously the other treatments for RDS are the NCPAP machines or ventilators that we see in the NICU, these basically helping babies breathe. This doesn't allow them to breathe on their own, and we see the ability of, we have to put tubes into the baby's intercostal ribs, and we have to be able to open those up, and we have to be able to help them breathe, essentially. And so it's really important that we have these NCPAP machines and ventilators, and that our NICU systems and our preemie divisions have grown so much, because sadly the treatments for RDS are consistently ongoing, and we're trying our best to be able to make our place in the world and save these children. And so this presentation today talked about RDS and surfactant and its role in specifically newborn babies. And this is an important feature, and we are continuing to do research on it every single day.